with remote patient monitoring in its infancy, now all that data was coming in all the time, every day, and there wasn't an on and off switch to it. It was kind of a constant flood of information, and they were just overwhelmed by that. And even a good business decision, if it's executed poorly, could be catastrophic for a clinic, small or large, if the patient health information gets out there. So I think a lot of the things that we're seeing right now too is we have an aging population that up to this point in their life maybe have been afraid of technology, but we also have another generation that's grown up with technology. On the healthcare side of things, I think that can be overwhelming and almost daunting, because now it's, there's a fear of going to WebMD or Google search and getting a diagnosis for your healthcare that isn't accurate. And now the doctor not only has to dispel that myth, but help them, calm down and recognize the things that they've actually seen aren't what Google or WebMD is actually prescribing them or telling them is going on.
Welcome to the Digital Health Transformers, a podcast series. In this podcast, we explore the dynamic world of healthcare innovation, one conversation at a time. I'm your host, Bryce Barger, and today we have an awe-inspiring guest at the forefront of transforming the healthcare landscape. I'm back with another key leader as our guest today, guys, Greg Forsyth. Greg is currently the managing director and partner at Cardiac RMS and has been in the healthcare and CRM space for over 2 decades now. He is passionate about improving the physician and patient experience in remote patient monitoring. His work at Medtronic and St. Jude has helped him understand the challenges the physicians and clinics face in delivering care. At Cardiac RMS, he focuses on delivering unprecedented service to his customers. He oversees service from pre-implementation to established customers. He also works towards improving his company is an award-winning software service provider in the remote patient monitoring space and aims to cater towards chronic care patients. We're excited to have you on the show, Greg, discuss the RPM technology. It's revolutionizing the chronic care managed space. How are you today, Greg? Thanks for joining us.
Doing great, Bryce. Thanks for having me. I'm excited to be here with you.
Yes, sir. This is such an important area that I don't think a lot of people have a ton of knowledge on. I think everybody might know RPM. They might understand what that might mean, but not really in depth and detail. So super excited to kind of get started here. As we get going with kind of your professional and your personal story, could you share with us your journey so far as a healthcare professional, and kind of what roadblocks did you face, and kind of how did you deal with them?
Sure. Yeah, I'd love to. So you kind of mentioned at the beginning, my background is with Medtronic and St. Jude that was eventually acquired by Abbott. Having worked for 2 large companies, there were a lot of roadblocks at the beginning. There was a lot of how do you get to the level of where you want to be within an organization of that size? Sometimes we have different career paths that we see ourselves going on, and maybe those corporations don't have those same roadmaps for you that you do. So I think that was a major hurdle at the beginning of it, was just aligning with the companies what I wanted to see from my own personal growth. And sometimes it aligned and sometimes it didn't, and there needed to be a change from one company to another. I think once I left those companies and started in the startup industry, I saw that there was a lot of issues in terms of getting our name out there, and we were so new in the industry that a lot of people didn't even know what we did because no one had done it before. So you mentioned RPM being new. Really, remote patient monitoring at the time we started in 2015 was fairly new as well. And it was just hard breaking into a lot of clinics and helping them understand who we are, what we did, and helping understand the value of what we could bring in a partnership with their clinic.
Gotcha. So I know you obviously have 2 decades of experience in healthcare and the CRM space. Greg, what do you think are the recurring challenges that most providers and clinics are facing, and kind of where do you see that value?
Great question. Kind of going back to the last question as well, is the reason I left the industry is we kind of started the problem, to be honest with you. When I was with Medtronic and St. Jude, remote monitoring was just getting started in the RPM space and the CRM space. So when we did that, a lot of people were just overwhelmed with the amount of data that started coming in. So here, they were used to seeing their patients, they were used to seeing people come into the clinic, having a programmer basically sitting there that they would download the information from and get the information as they came into the clinic. With remote patient monitoring in its infancy, now all that data was coming in all the time, every day, and there wasn't an
Mm,
on and off switch to it. It was kind of a constant flood of information, and they were
oh,
just overwhelmed by that. So
yeah.
what we saw, and when I talked to a lot of the partners I worked with at the time, we said, hey, could you see a need for maybe a third party company like ourselves helping you
Mhm.
digest the information and really receive information that's actionable to you in the clinics? And they said, yeah, that would be
Gotcha.
phenomenal to do that. And
Right.
and and that's where Cardiac RMS was born, with those opportunities to help clinicians better digest the information and use it in a way that is beneficial to the patients. The other aspect of that too is
Yeah.
because it's healthcare, change is scary. And a lot of times that change has a
Right.
lot of different connotations to it as well. So, you have your HIPAA policies that you have to protect, and you want to make sure all that data is secure. And so changing from one method of operation to another has a lot of regulatory effects behind it as well that can slow down the process a lot. So I think that's more than anything, those are the two biggest things of how do you deal with the glut of information that's coming, and two, how do you help people become unafraid of change that is in the healthcare industry can be overwhelming at times, and even a good business decision, if it's executed poorly, could be catastrophic for a clinic, small or large, if the patient health information gets out there.
Sure, for sure. And it's that old adage where too much information is no information. Where
Exactly.
it seems like where it's like drinking from a fire hose.
Exactly.
Or and you're right. I think the with digital health transformers and with the audience, we're all focused in this digital health space. And I think everybody has that challenge of how do we get these healthcare providers and these professionals um to embrace change and to embrace the technology and how we can truly affect patient outcomes and not just help their efficiency, which in turn could also maybe help affect outcomes, but truly being able to have this data and this information digested in a smart, manageable way to then turn it into true care. I love so much. And as I was just kind of speaking on, with digital health is growing in leaps and bounds over these last 10 years, I would say. What is your prediction of the future of digital health? It's kind of a broad question, but where do you kind of see that next step?
I think there's a lot of exciting times ahead. And I think, like you said, it is in the infancy. I think a lot of the things
Yeah,
that we've talked about, even to this point, and that people are aware of, it's so young and fresh, and it's so
right.
unknown to a lot of people that not only is that change scary, but it's also, are we just changing for change's sake, or can this actually
Yeah,
help us better manage and care for our patients? And I think that's ultimately where that change needs to happen, where we'll actually effectuate the better health and care of our patients when we do those type of things. So I think a lot of the things that we're seeing right now too is we have an aging population that up to this point in their life maybe have been afraid of technology, but we also have another
yes,
generation that's grown up with technology, and they
embraces
want
it.
not only technology to use it for their healthcare, but also they want that technology to be seen by their healthcare provider and
Mhm.
utilized, and almost automatically come back to them with, here's what's going on with you, here's how we can help you, here's what needs to change. So it's a little tricky at this time because you have a large aging population where you have to make sure that they feel comfortable with the new technology that's out there, and able to monitor them, but you also have to help that younger generation feel valued and seen, and that the things that they're wanting from healthcare are available to them in healthcare. And I think that's the exciting time about this is, we have Apple Watches or Google Watches or Fitbits or things like that are consumables that people can buy on their own, that they don't have to be prescribed by the doctor, and they can show them what their health care is. On the patient side, that's exciting for them because it's, now I have the opportunity to see my healthcare and really take it into my own hands of what I want to see happen. On the healthcare side of things, I think that can be overwhelming and almost daunting because now it's, you know, there's a fear of going to WebMD or Google search and getting a diagnosis for your healthcare, that isn't accurate.
Yes.
And now the doctor not only has to dispel that myth, but help them, calm down and recognize the things that they've actually seen aren't what Google or WebMD is actually prescribing them or telling them is going on. And actually, that can be the biggest hurdle with this digital transformation. It's helping the
Yeah.
patients feel secure in what's coming along, but also not overburdening and overwhelming our physician population with misinformation, to be completely honest, or um, a glut of information that isn't helpful to our physicians as well. So I think it's exciting, but we're really in a time of how do we direct this and how do we focus all this information in a way that's beneficial for both patient and the healthcare society.
I love that. That's very true. It's kind of a fine line of
Mhm.
being able to provide and have the patient be involved in their care. But you're right, but still, um, you know, but still allow them to seek out the knowledge of the healthcare provider to help analyze that and help tell them what to do and help guide them still, but still have them more involved in the care, which is I see that even in my I'm a type 1 diabetic, and use um the continuous glucose monitor and the insulin pump.
Yeah.
And I'm actually new. I've been diabetic since I was 10 years old, but just recently started this continuous glucose monitor, and being able to track truly like I can go back a month or two and um, look at my blood sugars and truly watch them day by day, hour by hour, and see, well, okay, this is what happens at night. This happens. And then if I have questions, go to my endocrinologist and say, hey, listen, or not even that, they download my, they're luckily that they're integrated. They download my information right to it. And it's such a well-rounded form to where now when I go into the doctor's office or my endocrinologist meeting every 3 months, I'm having true conversations that are actually helpful. It's not you're not a recap of what's happened these last couple months of what you can remember and what you've written down on your paper.
Yeah.
So seeing that and what you guys are, I know it's truly amazing, and is definitely the next step. And it's helped me personally a whole lot.
And I think
So
a lot of
kind
people feel
of
that same way,
as you
Bryce.
guys are actively working on our, go ahead,
Sorry, I was just gonna say, I
go
think a
ahead.
lot of
I'm
people feel
sorry, I
that
cut
same
you off
way
then.
as well. That's the exciting
Yeah,
part about this next step in digital healthcare is because people want to be more involved in their health. They
yeah,
want to be able to see, like you did with the continuous glucose monitor, of I can see how I'm progressing or I can
mhm,
see how I'm feeling, and it correlates to the readings that are coming
yeah,
through on that continuous glucose monitor. So I can make those changes, not having to make an appointment to see the doctor, but I can make those changes that I've discussed with the doctor ahead of time so that
right.
I don't ever decompensate or crash or have these incidents that can't be handled
Mhm.
more quickly. And it never gets to a point where I feel horrible, but I can be well maintained all along in between those visits. And that's really the exciting part of RPM and virtual care management and care management.
Yeah, I didn't even really think about that, but you're also kind of like it's a education tool, like right where
Mhm.
um you're being able to educate the chronic user, the diabetic, in my opinion, of how to read that, how to look at that. So when they have these intelligent conversations with the provider, they're not only having helpful care on their visits, but also they're learning to where, like as you just mentioned, to where when they do see maybe a trend or something that they can identify it or ask for say, hey, this is happening. I need to go talk to my provider right now. I can see this something's not right here. So that's a really great point. I love that. Getting into kind of the next question here, as you guys are kind of actively working with RPM technology, what obstacles do you think would hinder kind of the chronic, kind of staying in this chronic patient care, diabetes that we're maybe talking about? What obstacles do you see that might hinder chronic care patients?
Yeah, I think there's a lot of things with it. Like health disparities, obviously, is a huge part of it. Some
Mhm.
people have more access readily available to them than others.
Yeah,
It could be as little as an internet
great point.
connection that's reliable. So a lot of these, like continuous
Great
glucose
point.
monitors or RPM technology, they rely on the ability to actually transmit the data. It seems
100%.
it seems crazy to talk about it, but there are parts of the country that just don't have the ability to do that. You know, it used to be dial-up service that you had to do in those areas, and even that's gone away. So they don't have the ability to send the information reliably to the clinicians. And I think that's
Mhm.
one of the biggest obstacles is how do we overcome that? You know, I know there are a lot of initiatives in the country to get fast, reliable Wi-Fi internet to everywhere, and that's great, and that's definitely going to help with some of that disparity. And that's really what will change chronic care management throughout the country is allowing all patients to have access for a lot of different reasons. You know, for some of those patients, it's hard to get to the doctor. You know, they've got to take the
Mhm.
whole day off or maybe even a 2-day travel, depending on how far they have to go.
Right,
And
100%.
then they're waiting in the office for an extended amount of time, and then they got to travel back home. Maybe there's an overnight stay involved with that, depending on how rural the area is. But to be able to have that data at the doctor's fingertips and not have to travel, you know, have equipment that they can put on in their car or as they're traveling on vacation or take it with them so it's easily accessible and the doctor can have it, that's life changing. You know, that's how you really have this paradigm shift of going to the physician to care for you when you're sick to being cared and treated for at home and taken care of. It feels almost like a step back in time, right? The doctor's visit coming to your home and taking care of you, but doing that digitally or doing it in a way that is comfortable and convenient for the patient, but also delivers the information that the physician needs.
Yeah, reliably and still gets the job done still. That's the ultimate key is, hey, if I can if I can save my grandfather the 2.5 hour trip to Birmingham, because he lives, in rural Alabama,
Right.
and that's everything. That's everything. It saves everybody time. And also, and now that we have the technology to provide reliable data, what's stopping us? What is it other than these, like you mentioned, these internet connections and these, they're not small hurdles, but they're hurdles that can be overcome.
Agreed.
With the right um, pieces in place. So
And I think with the right buy-in from the right decision makers involved with that
true,
as well. Obviously,
true,
there's a lot
100%.
of that has to be put in place to make it usable by everyone.
Yeah, 100%. So with RPM tools, do you guys think that we can eventually eliminate those healthcare disparities within the chronically ill population?
I do. Yeah, I do. I think we can, like we just talked about, a lot of that can be addressed in allowing some of these things to happen. But also, I think having the patient see the benefits of it. I mean, I think on both sides
Yeah.
of things, when the patients see the benefit of it, they're going to have more buy-in to it. And maybe it is a little more expensive to get that reliable internet service. But if it saves them the trip to the doctor 2 hours away, like you talked about in rural Alabama to Birmingham, it makes sense to put forth a little bit of that extra money. So there's buy-in on both
It does.
sides, not only physicians and the infrastructure, but on the patients themselves. Once they see, hey, I feel so much better when I'm monitored by a clinician who can
Mhm.
really help me out. I can also avoid those day-long trips or maybe half of my day being uh, consumed by going to the physician's office. And if
Right.
all those things are beneficial for both the physician and the patient, I think you'll overcome a lot of those gaps, and you'll see that it makes sense for the infrastructure to be there as well, but also for some of the out-of-pocket costs for the patients, because there is a trade-off of, hey, I'm saving gas, I'm saving travel expenses, I'm saving the chance to have to miss work, but now I'm able to be cared for, and it makes sense for me to have maybe a little bit faster internet connection or pay for a wireless phone connection or whatever it might be. And I think that's how we start to bridge that gap and do it more quickly when people can see the benefits on both sides.
Yeah. Buying in effort, as you mentioned. Can you kind of getting back to, cardiac RMS and can you share with us kind of an incident of a successful intervention in chronic care delivery by chronic care?
Yeah, so I love kind of the foundation of cardiac RMS has always been patient
Yep.
care, been patient driven. We're founded by clinicians, and one of our mottos is, it's like having a nurse in the family. That's what we always like to say. And I think one thing that we've
Love that.
talked about is there's been wonderful studies that talk about here's all the benefits of RPM or patient care management and all those type of things, but it's the one-on-one anecdotal evidence of this is actually working that we love to talk about at Cardiac RMS. And there was one time where one of our RPM technicians who had talked to a daughter of one of our patients, the daughter called up and said, you know, my dad loves this service. It's completely changed his life. He used to have to go to the hospital for extended stays monthly, at least a couple of times a month. He was in the hospital. Ever since he started this RPM and care management program with your company in conjunction with his physician's office, it's been night and day different. He hasn't been to the hospital since then. He feels so much better. And those are the anecdotal evidences of, hey, this is actually working for individual patients. This is actually helping them completely change their life. And it switches from being, like we've talked about, it switches from being medical care after someone's decompensated to you're actually caring for patients proactively and helping them take care of things before any of those issues become a problem. And really relieving some of that burden on our healthcare system of, you know, if these patients don't have to come into the office all the time to be taken care of because they're sick, but you're getting that data ahead of time and taking care of the problems before they become a problem, that completely changes things. That's the paradigm shift we're looking for.
Yeah, let's be proactive instead of waiting for and being reactive, right?
Exactly.
Yeah. This is it's always so funny to me whenever I have these conversations and and hold these podcasts, because I talk to a wider range of digital leaders and entrepreneurs, people who have innovated, and very impressive people. And it's so funny how even somebody with myself, who I would consider myself plugged in, if you will, or kind of in the know of a lot of these digital technologies that are available. And it's incredible that every time I have these conversations, I connect it to somebody in my life, like my wife's grandfather, who is having to make that exact trip that I was talking about from Lower Alabama up to Birmingham for his heart condition,
Yeah.
and being like, wow, do I need to connect him with Cardiac RMS? Is this something that he could use? I need to study on this. Now I need to talk to my father. But it's just so funny how, um, you know, all these technologies are out there, and people, sometimes you just don't know about them, and how much they can greatly impact your life or your family's lives. And this is just something I will be doing more research on when we get off this call, Greg. I'm going to see if this is something that he can use. My wife's a pharmacist and is very involved in his medical care, and so I just really love um, the aspect of being able to have that RPM work, and it's reliable information that your doctor receives, that you also are proactive in your care, and then you guys are um, solving problems before they become problems, or at least attempting to, right? If it might not always work out, but it's at least an attempt in something that and trying to better yourself. So, Greg, that's all the questions I have for you today. Thank you so much for joining us to kind of discuss the RPM technologies and how it can cater to chronic patients. And your views on RPM and digital health and effective chronic care management were insightful to me personally, and very interesting, I'm sure, to our listeners. It was great learning from you with your deep expertise in this area. It really was. Thank you so much for joining us.
Bryce, I appreciate it. It's been a pleasure being able to visit with you. If you want to talk about your family, give me a call. I'd love to talk through things with you to help, answering those questions you might have. That's
Sure.
like I talked about, that's where this was born from, and that's what brings me the most
Yeah.
excitement, is actually helping people change their lives and helping people have the care that they need. And sometimes that starts with the patient and then talks to the doctor. Sometimes it's the complete opposite. You talk to the physician that needs this help, and they bring it to their patients. But ultimately, we want everyone to have access to that care and have it be readily available. So I appreciate it. It's been a
Sir.
pleasure talking with you, Bryce.
Yes, sir. We will definitely connect further. Thank you so much for your time, Greg. Talk to you
All
soon.
right. Take care.
All right. You got it. Bye.